Well, thousands of nurses and midwives are picketing public hospitals across New South Wales for the next 24 hours. They're demanding nurse-to-patient ratios and a bigger pay rise. Kenny Heatley is at Westmead Hospital in Western Sydney for us this morning. Kenny, the nurses there are in for the long haul today, aren't they?
Yes, they are. This is a picket line strike action. They say that they haven't done this since 2013, and they're calling it historic, meaning that they're not just here for a few hours, they are here for 24 hours straight, and some have even brought their sleeping bag. We've also got a barbecue set up. Later on, there's going to be bands as well. Here at Westmead Hospital, they're expecting 2,000 nurses to come in and out here over the next 24 hours to make their presence felt. They're calling for a pay rise that matches inflation of around 7%, but they're also calling for nurse-to-patient ratio, something they've been calling for a long time. I spoke to a couple of nurses in the picket line. Let's hear from them now.
My concerns are for the safety of our patients and also the safety of our staff. To practice properly with the correct ratios would lessen the errors that get made.
We believe that nothing's being done, nothing's changed, it's just getting worse.
This is statewide strike action. This is not just occurring in Sydney or in Western Sydney, it's right across the state, from Albury to Ballina, 60 locations where they are setting up picket lines today. They tell me that critical care will still be taken care of in public hospitals, but some surgeries may be delayed as a result of the nurses out on the street today. Of course, Dominic Perrottet, the Premier, he's had to deal with a lot of union industrial action over the past year. More recently, there has been a bitter contest between the rail union and the state government. The Premier losing patience with them, but also here they're hoping the Premier will listen. Well, the Premier was on breakfast television this morning. Here's what he had to say.
We've put our pay offer obviously to the unions across the public service, and that's at 3% for this year and 3.5% next year. That is the leading policy in the country when it comes to wages. I think only Queensland matches that. I was this week with the Victorian Premier announcing more urgent care clinics, which we'll roll out, which is generally a federal responsibility, but where we want to step in there to ease pressure on the emergency departments. And we'll continue to work very closely with the Commonwealth Government.
But the nurses here, Laura, they're saying the Premier is not listening to them, and they're hoping that their voices will be heard today.